We have heard this and many other stories about people moving mountains to get a vaccine. But in a couple of months, we might have the opposite problem. That is very hard to believe. My next guest says the vaccine supply might be greater than demand as soon as April. I want to bring in Dr. Scott Lieb. He was the FDA commissioner under the Trump administration, and he now serves on Pfizer's board of directors. Dr. Gottlieb, that's hard for me to believe as somebody who has spent an enormous amount of time trying to get my own family members vaccinated and failed at it. You think by April we're going to be flooded with supply?
I think it's possible that we're going to see supply outstrip demand and we're going to have general availability. That doesn't mean that everyone's going to be able to go online and get an appointment April 1st to get vaccinated, but it does mean people will be able to go online and start scheduling appointments come some point in April. If you look at the supply that's coming onto the market, Moderna and Pfizer, the company I'm on the board of, have said that they're going to put out 220 million vaccines by the end of March. If Johnson & Johnson gets approved in early March, they're probably going to come into the market in March with another 20 to 30 million doses. So that's about 250 million doses. If you assume a 60-40 split in terms of 60% going to first doses, 40% going to second doses, which I think is fairly conservative, that's about 150 million people that you can vaccinate between now and the end of March. That doesn't mean we'll get all of them vaccinated. There's going to be some supply that remains in the system. But I suspect that demand here, the really brisk demand, is maybe 75 to 100 million people. Once you get beyond that, I think you're going to have to open this up to general availability. Right now, we're working through 65 and above. I think we'll finish that by the end of the month. In March, we'll start making the vaccine available to other groups, other prioritized groups. But eventually, you're going to have so much supply and not enough demand. I think you're going to have to open this up to general availability. And that will probably be sometime in April.
Then are we going to have enough technicians, doctors, nurses to administer all these shots?
Look, the administration, I think, has done a good job taking sort of an all-of-the-above approach in terms of how they're pushing this out. They're giving an increasing amount of supply every week to states. So the state supply has been increasing every week. It's about 12 million doses right now that are going out every week. And they've started to push it out through the community health centers, the federally chartered community health centers, and also the big box stores, Rite Aid, Walgreens, CVS, Walmart. They could push out a lot more volume through those channels, through those big box stores and the community health centers. So by getting them stood up now, I think as more supply comes into the market, if the states aren't able to handle the supply because they haven't stood up enough sites, they don't have enough vaccinators, I think the other parts of the distribution system, those big box stores in particular, can handle a lot of volume. Remember, we vaccinated 123 million adults for flu last year in the middle of COVID season. Most people didn't get their flu shot at their doctor's office. Most of them got it at a community pharmacy or at a big box store. So we do have an adult vaccination system in this country. It happens to be the large chain store pharmacies and the community pharmacists.
There's still been a lot of confusion, even for those who are vaccinated. While they might not get sick, they could still spread it. Dr. Fauci just mentioned 2 new studies that show not only won't you get it, you won't be a spreader. How big of a deal is that?
Well, it's very important. From a public health standpoint, the vaccine will have a much more substantial impact if it cuts down on an infection and reduces your likelihood of spreading the infection. I think conventional wisdom is the vaccine does reduce your likelihood of getting infected and does reduce your likelihood of spreading the infection based on data that we have accruing to us right now. The question is going to be the magnitude of that benefit. I don't think we've quite nailed down how much it cuts down on transmission. I think most people believe that it is cutting down on transmission to some extent.
Can we talk for a moment about numbers? Because you've got states like California and Florida. California basically shut down and Florida wide open like it's spring break 2021. What do you make of this difference? Because Governor Ron DeSantis has taken a victory lap over this.
Yeah, look, Florida's had a difficult experience, and so I wouldn't say that the Florida experience has been easy. There has been a lot of infection in that state. I think they're 4th in terms of the number of deaths and infections, 4th or 3rd. I think it's hard to make comparisons across different states. Different states have experienced the epidemic at different points in time. Different states have different density. The virus got into different parts of different states. And so in some states, it got into a more rural part of the state. In some states, it got into very dense cities. I think if you look at what happened, for example, in March and April in New York, you really can't compare the New York experience to the experience in, let's say, Phoenix later on in the summer, because we didn't know what we know now when this infection first started to spread in the spring of 2020. So it's very hard to make comparisons across states. I would shy away from doing it. It's been a very different experience across different parts of the United States.
But knowing what we know now, should we look at lockdowns or restrictions in a different way?
I think we should. I mean, look, we did the mitigation, the broad-based mitigation back in the spring when we had the epidemic in New York, largely because we didn't know where the virus was spreading. We weren't able to target the mitigation just to parts of the country and cities where we knew the virus was spreading because we didn't have a diagnostic test. Right now, we have very good data on where the virus is and where it isn't. So you can target the steps more accurately. You can also use testing and tracing as a tool to try to contain spread. So we're in a much different situation now with a diagnostic test widely deployed that we can actually target our public health interventions based on where the virus is actually accruing.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.